Have you ever considered the possibility that, without your knowledge, your nightly routine may be endangering your life? Surprisingly, more than 70,000 older persons die in their sleep every year in the United States alone, according to the Centers for Disease Control and Prevention. The scary part? Age isn't the only factor in many of these deaths. They are linked to minor, avoidable nightly routines that the majority of people don't even consider. Your body undergoes subtle but significant changes after the age of 60. Your brain becomes more sensitive to disturbances, your lungs more sensitive, and your heart more delicate. Your muscles weaken, your sleep becomes lighter, and anything that seemed safe before bed can suddenly become deadly. However, the majority of senior citizens continue to follow their habits without realizing that they may be subtly endangering their long-term safety and health. What precisely are these unseen dangers concealed in your nocturnal routines, then? Which typical bedtime error causes the most emergency situations at night? More importantly, what can you do now to improve the safety and health of your sleep? We're delving into 7 nocturnal behaviors that have already taken the lives of numerous seniors this year in today's video. The second habit is one you should be very aware of. It's unexpectedly lethal. Don't worry though, starting tonight, I'll also provide you easy ways to stay safe. Welcome to the channel if you're new. Together, let's get healthier and stronger. To ensure you don't miss our next update, please press the subscribe button and like this video. To let us know where you're watching from, please include your nation in the comments. We enjoy witnessing the expansion of our global community. Let's get started. The 7th habit is excessive water consumption right before bed. Let's discuss a seemingly innocuous bedtime behavior that may be subtly endangering your health. Consuming excessive amounts of water before bed. It's critical to stay hydrated, particularly as we age. Water aids digestion, maintains the flexibility of your joints, and keeps your organs working. Drinking too much water right before bed might backfire, especially for older folks, even if it's crucial to drink enough during the day. Our kidneys become less efficient at processing fluids as we age, and our bladder's capacity decreases. Furthermore, the cues that we need to go to the bathroom become more frequent and abrupt. Therefore, your body is more prone to disrupt your sleep with urgent bathroom breaks if you consume a lot of water, juice, or herbal teas within an hour or two of going to bed. Although waking up once or twice might not seem like much, it raises the risk of falls during the night for seniors. Imagine this: your equilibrium is off, the room is dark, you're sleepy, and standing up fast decreases your blood pressure. That little trip to the bathroom could become a potentially fatal tumble. According to the CDC, falls are the leading cause of hospitalization for older individuals, and many of these mishaps occur during overnight restroom visits. However, that's not the only issue. Urinating frequently disrupts your sleep cycle, particularly the deep periods that aid in reestablishing bodily and mental functions. Long-term sleep disturbances have been linked to increased inflammation, memory loss, and an increased risk of diseases including dementia and Alzheimer's. In addition to impairing immunity, sleep deprivation can exacerbate diabetes and hypertension. An additional heart danger is included as well. Your heart has to work harder to handle the extra volume if you drink too much at night. For a person who already has cardiovascular problems, this may cause irregular heartbeats or unnecessary cardiac strain. So, how can one securely stay hydrated? Everything comes down to balance and timing. Start consuming less water in the evening after consuming enough throughout the first part of the day. Avoid drinking a lot of liquids at least 2 hours before bed. Limit yourself to a few sips rather than a full cup if you are feeling thirsty right before bed. Additionally, stay away from diuretic or caffeine-containing beverages including coffee, black tea, and citrus juices in the late afternoon. They will just make you use the restroom more frequently. Make sure your route is safe, use motion-activated bulbs or nightlights, and clear away any debris that can trip you up if you must get up in the middle of the night. Take your time standing, move cautiously, and let your body to acclimate. You can stay hydrated by making these minor adjustments without compromising your safety or your ability to sleep. Eating at night is habit number 6. Having a small snack before bed, especially after a long day, may seem innocuous. However, this widespread practice may be more subtly harmful to your health than you may realize if you're an older adult. Although that late-night pleasure can feel cozy, it might cause a series of problems that extend beyond mild indigestion. Our bodies begin to react differently to food as we age. It becomes harder to control things like blood sugar and cholesterol, digestion becomes less fluid, and metabolism slows down. Therefore, your digestive system does not get the downtime it needs when you eat rich or heavy foods late at night. Your body continues to work on processing that food during the night rather than resting, which not only interferes with your sleep but also strains your liver, heart, and digestive system. Acid reflux is among the most prevalent issues caused by eating late at night. After eating, stomach acid can easily travel up into your esophagus when you lie down, giving you that excruciating burning feeling in your chest. In addition to being uncomfortable, this can cause inflammation, esophageal damage, and even aspiration pneumonia in elderly people who inhale particles while they sleep. Eating within 3 hours of going to bed increases the likelihood of reflux and its associated problems during the night, according to a study published in the American Journal of Gastroenterology. However, that's not the only problem. Your blood sugar levels may rise if your evening snack consists of refined carbohydrates or sugary meals. Our cells lose their sensitivity to insulin as we age, making appropriate glucose management more difficult. If you currently have type 2 diabetes, this can exacerbate it or cause it to develop. Eating late is associated with greater morning blood sugar and insulin levels, particularly in older adults, according to a 2020 study published in the Journal of Clinical Endocrinology and Metabolism. Additionally, you might not immediately detect your blood pressure. It usually falls while you sleep to allow your heart to relax. However, eating late, especially if it's anything fatty or salty, can keep your blood pressure high all night, raising your risk of having a heart attack or stroke. Heavy nighttime meals can occasionally even cause abnormal heartbeats, which can be problematic for people who already have heart issues. So, how do you eat well while remaining safe? The secret is timing and making wise dietary decisions. To ensure healthy digestion, try to finish your last meal at least 3 hours before going to bed. Avoid heavy, greasy meals and sugary desserts in favor of lighter, more balanced dinners that include veggies, lean protein, and whole grains. Choose something little and delicate, like a banana, a spoonful of plain yogurt, or a handful of unsalted nuts if you're truly hungry later. These choices won't cause a blood sugar rise and are kinder to your tummy. You'll sleep better and reduce your risk of major issues like heartburn, high blood sugar, and cardiovascular stress by making a small change to your routine. Your body will feel stronger and healthier every day if you give it the sleep it needs at night. The 5th habit is sleeping in the incorrect position. Whether it's stretching out on your back or curling up on your side, everyone has a favorite sleeping position. However, many older folks are unaware that their chosen nighttime posture may be subtly endangering your health. As you become older, your sleep habits can have an impact on your heart and breathing, as well as the health of your brain. First, let's talk about one of the worst sleeping postures for seniors, the supine position, which is lying flat on your back. Even while it might feel comfortable, this posture can lead to a number of health problems. The airway narrows when you lie on your back because gravity pulls the tissues of your throat and tongue backward. For those who have sleep apnea or snore, this becomes more problematic. However, this restriction can decrease airflow even in the absence of a formal diagnosis. According to research from the Mayo Clinic Sleep Disorder Center, lying on your back can exacerbate breathing problems by up to 40% when compared to sleeping on your side. The consequences of this limited airflow can be severe. Oxygen depletion during sleep raises the likelihood of obstructive sleep apnea, which results in frequent breathing pauses. This can cause brain damage, elevate blood pressure, and dramatically increase the risk of heart attacks and strokes over time. Seniors who sleep on their backs are 22% more likely to have cardiac episodes at night than those who sleep on their sides, according to research published in the Journal of Clinical Sleep Medicine. However, respiratory problems are not the only difficulty. Seniors who sleep on their backs may experience worsening symptoms from acid reflux or a hiatal hernia. It facilitates the passage of stomach acid up into the esophagus, which may result in silent reflux during sleep. If acid gets into the lungs, this can harm the lining of the throat and possibly increase the risk of aspiration pneumonia. Repeated exposure over time may cause esophageal cancer. Additionally, an increasing amount of research indicates that the way you sleep has an impact on your brain's capacity to self-clean. Stony Brook University researchers discovered that resting on your back lowers the brain's waste clearance system by almost 60%. This system is in charge of eliminating harmful proteins, such as those connected to dementia and Alzheimer's disease. Therefore, poor sleep position may hasten older persons' cognitive loss. There are disadvantages to sleeping on your right side as well. Major blood veins close to the heart may be compressed, impairing circulation and increasing the risk of heart failure, particularly in elderly people who already have cardiac issues. What is the safest method of sleeping then? The left side is the best, according to experts. Sleeping on your left side lowers the risk of stroke and acid reflux while promoting good digestion and improved circulation. Additionally, it protects long-term mental performance by enabling your brain to eliminate waste more effectively. Although changing positions may first feel uncomfortable, there are several tips to help. To maintain your hips in alignment, place a firm pillow between your knees. To prevent rolling over, tuck another pillow behind your back. Your head can remain in the proper position and your spine supported with a properly made neck cushion. Raising the head of your bed a little might also have a significant impact if reflux is a problem. Although it may require some work to get used to sleeping on your left side, the health benefits are substantial. Making changes to your sleeping habits can help you sleep better and have a healthier future by reducing your risk of heart problems, respiratory issues, and mental loss. Sleeping in a hot room is habit number 4. As we age, we frequently look for warmth at night. It's normal to want to feel comfortable, which may involve closing the windows tightly, cranking up the temperature, or layering blankets. But many people are unaware of this. Older folks may be discreetly endangered by a warm bedroom. The ideal sleeping environment for seniors is important for their safety and well-being, not only for their comfort. When it's time to go to sleep, your body automatically lowers its core temperature. You can enter the deepest, most restorative sleep stages thanks to this cooling down. However, your body finds it difficult to expel heat if your room is excessively heated, usually above 24 degrees Celsius. Your system remains active in an attempt to cool down rather than falling into slumber, which frequently results in disrupted sleep, numerous awakenings, and a sensation of exhaustion the following day. However, heat has an effect on sleep that extends beyond restlessness. Because the body's ability to regulate its temperature deteriorates with age, older persons are more susceptible. The American Journal of Geriatric Psychiatry reported that seniors who sleep in warmer settings have up to 30% less deep sleep, which is crucial for immunological support, memory processing, and cell repair. Ignoring this crucial stage of sleep might lead to more serious health issues. Inflammation, hypertension, and weakened immunity are all exacerbated by little sleep. Serious health problems like heart disease, type 2 diabetes, and mental decline are made more likely by these impacts. According to the same study, chronic heat-induced sleep deprivation may hasten memory loss and increase susceptibility to infection. Dehydration is another unspoken risk of a heated room. Elderly people frequently have less thirst, and perspiration at night results in a loss of electrolytes and fluids. In addition to impairing hydration, this may thicken the blood, increasing the risk of blood clots, irregular heartbeats, and stroke. The additional strain of controlling body temperature at night may cause major consequences, such as heart failure or respiratory distress for people with heart or lung disorders. What is the ideal temperature for sleeping, then? Maintaining a temperature in your bedroom between 15 and 19 degrees Celsius is advised by experts. Avoid bulky quilts or electric blankets that hold too much heat, and choose for bedding that is light and breathable, such as cotton sheets. Choose layered blankets that are easy to remove if you are prone to getting cold. To keep the space feeling fresh, a fan or broken window can help increase airflow and release trapped heat. Modest adjustments to your sleeping environment can make a significant difference. Not only does chilling your bedroom make it more pleasant, but it also protects your heart, maintains your memory, and promotes higher quality sleep. Maintaining a cooler sleeping environment is an easy yet effective way for seniors to age healthily. Leaving bed too soon is habit number 3. Have you ever felt dizzy or as though the world is spinning after waking up in the middle of the night and swinging your legs over the edge of the bed? It's not just in your head, and you're most certainly not alone. Unexpected movements when getting out of bed can be more risky for older persons than most people realize. Every year, this one habit is the cause of innumerable falls, injuries, and ER trips. Postural hypotension, also referred to as orthostatic hypotension, is the underlying cause of this problem. It occurs when you suddenly become upright after lying down, causing your blood pressure to decrease. Our circulatory system becomes less adept at adapting to changes in position as we age, which facilitates blood pooling in the lower body. Feelings of lightheadedness, blurred vision, or even a brief loss of consciousness are brought on by this temporary interruption in blood flow to the brain. This poses a genuine risk rather than merely being an irritating annoyance. Seniors with postural hypotension are significantly more likely to experience falls, fractures, and even mortality, according to research published in JAMA Internal Medicine. Many falls happen late at night or early in the morning, when the body is still adjusting from rest and blood pressure is usually lower. Falls continue to be the leading cause of injury-related hospital admissions among older persons, and one unfortunate slip can have disastrous consequences. Among the most frequent injuries are broken wrists, hip fractures, and head trauma. For many people, a single fall can signal the start of diminished mobility, a loss of independence, or major long-term health issues. Recovery is frequently drawn out and unpleasant. It is crucial to tackle this habit with the gravity it requires because of this. Fortunately, there isn't much work involved in preventing this issue. Slowing down is the best course of action. Spend a few minutes sitting up straight on the bed when you wake up so that your body has time to adjust blood flow. Breathe deeply, flex your ankles, and move your feet. This mild motion reduces blood pressure fluctuations and aids in circulation adjustment. If you often wake up dehydrated, keep a glass of water by your bedside and take a cautious sip before getting up. Additionally, environmental safety is important. Use motion sensor lighting or night lights to ensure that the area leading to the restroom is well lit. Put on non-slip slippers instead of slick socks. To save people from tripping, keep carpets and clutter out of the path. For added support when getting up, cling to a grab bar, bedpost, or dresser if you can. Consult your physician if you are on any blood pressure-lowering drugs, such as beta blockers or diuretics. To lower risk, they could advise modifying your dosage or the time you take your medications. You can significantly reduce your risk of a dangerous fall and preserve your freedom and safety by simply implementing some minor adjustments to your bedtime routine. Thus, take your time waking up. It's not only about feeling better when you take your time, it's essential to safeguarding yourself every night as you get older. The second habit: frequent breathing pauses, snoring, or persistent sleeplessness. Particularly as people age, snoring is often dismissed as a minor irritation. But what if the sounds you hear at night or the times when your breathing seems to stop are warning signs of something far more serious? Ignoring these signs in older persons might result in major, sometimes undiscovered health problems that could be fatal. Obstructive sleep apnea is one of the most dangerous but often ignored disorders that affect the elderly. This condition occurs when the throat muscles relax excessively as you sleep, narrowing or closing your airway. This results in brief pauses in breathing, sometimes occurring dozens or even hundreds of times during the night. Every time it happens, the oxygen levels fall, making the heart work harder and putting more strain on the body as a whole. This ongoing stress can eventually lead to hypertension, an irregular heartbeat, and a markedly increased risk of heart attack or stroke. The figures are startling. Untreated sleep apnea increases the risk of strokes by up to 60% and deadly heart attacks by 30% in older adults, according to data from the Sleep Heart Health Study. Sleep apnea is thought to affect over 4 out of 10 older persons, although about 80% of those instances are never diagnosed. Many people don't realize that snoring or frequent waking could be a dangerous condition in disguise. They just think it's a typical part of aging. However, it goes beyond the heart. Long-term sleep deprivation and sleep apnea prevent the brain from getting the deep sleep it requires. Seniors who don't get enough sleep may have mental haze, memory loss, and even early cognitive impairment. According to some research, if left untreated, sleep apnea can cause the loss of brain tissue, particularly in regions responsible for memory and reasoning, at a rate that is nearly 3 times quicker than normal aging. So, how can you tell whether you may have sleep apnea or a related condition? The first person to notice is frequently someone else, such as a spouse or caretaker. Loud snoring, gasping for air as you sleep, prolonged breathing pauses, or frequent awakenings are important warning indicators. Additionally, even after a full night in bed, you may experience morning headaches, dry mouth, or unusually high levels of fatigue throughout the day. Another crucial indicator is insomnia, whether it manifests as trouble falling or staying asleep. While it's normal to experience occasional insomnia, persistent insomnia may indicate underlying medical issues such as hormonal, neurological, or heart issues. Additionally, it weakens the immune system and increases stress, which makes it more difficult to control diseases like diabetes and hypertension. It's time to act if any of these symptoms seem familiar. Consult your physician or a sleep specialist. Treatments including weight control, lifestyle modifications, and CPAP equipment can significantly lower the health risks. In fact, studies have shown that appropriately treating sleep apnea can reduce older persons' risk of heart-related incidents by up to 42%. Sleepless nights and snoring are more than just bothersome habits. These are very important health warnings. By taking care of them, you can protect your heart, maintain your brain, and enhance your general health as you age. The first habit is taking some drugs right before bed. Medication at night is a common evening ritual for many senior citizens. It seems like a harmless step before going to bed, whether it's for blood pressure, joint discomfort, or sleep. However, as we age and our systems change how they handle pharmaceuticals, several of these seemingly commonplace drugs may actually be dangerous when taken right before bed. First, let's talk about anti-anxiety and sleep aids. Diazepam, clonazepam, and alprazolam are examples of benzodiazepines, which are medications that relax the nervous system and facilitate sleep. However, they also lower alertness and impede respiration. This impact can be dangerous for elderly people, particularly those who already have heart or lung issues. Seniors who routinely take these drugs are more likely than those who don't to experience falls, fractures, and even early death, according to research published in the British Medical Journal. The sleepiness isn't limited to the night. It may persist throughout the following day, leading to shakiness, disorientation, and an increased risk of hazardous slips or accidents. And there are other issues than sleeping medicines. Certain antidepressants and muscle relaxants, which are frequently recommended for nighttime usage, can disrupt the deep sleep stages that your brain requires to remain alert. This lack of rest may eventually accelerate cognitive deterioration and cause memory issues and mental fog. Medication for pain should also be used with prudence. Even though NSAIDs like ibuprofen and diclofenac work well for painful joints, frequent usage, especially at night, can strain the liver and kidneys. Additionally, they may make internal bleeding more likely, especially if you're on other blood-related drugs. Medications for high blood pressure are also frequently taken at night. Some people find that taking these drugs at night helps them, but others may see a significant decrease in blood pressure as they sleep. This can cause symptoms like lightheadedness, fainting, or even a stroke by decreasing blood supply to the brain. The timing of blood pressure medications has a significant impact on heart health at night, and different people react differently, according to a study published in Hypertension. Not to be overlooked are medication interactions. Our metabolism slows down with age, which facilitates the accumulation of drugs in the body. Without proper supervision, taking a combination of cardiac medications, pain relievers, or sedatives can have harmful or even fatal effects. So, how can you protect yourself? Before beginning, stopping, or changing your pharmaceutical regimen, always with your doctor or pharmacist. Inquire about non-sedative alternatives, particularly if you're feeling sleepy, mentally disoriented, or groggy in the morning. To wind down, try natural methods like chamomile tea, light stretching, or deep breathing exercises instead of taking sleep aids until absolutely required. Keep track of your blood pressure readings if you're taking medication, and notify your doctor straight away if you experience any unusual symptoms. You're taking a significant step to safeguard your health, avoid mishaps, and enhance the quality of your sleep by being knowledgeable and cautious when taking your bedtime prescriptions. A few well-considered adjustments can significantly improve the safety of your evenings and the brightness of your mornings. As we draw to a close, it is evident that even small adjustments to your bedtime routine can have a significant impact on your longevity and general health. It's time to change your sleeping habits tonight, now that you are aware of these 7 detrimental ones. Every little change can contribute to a longer, healthier life, whether it's controlling your medication schedule, making changes to your sleeping environment, or being mindful of what you eat before bed. Have you ever unintentionally engaged in any of these behaviors, or do you have a clever trick that has improved your quality of sleep? Leave a comment with your ideas. Telling us what has worked for you would be wonderful. For more useful wellness advice, please remember to like, subscribe, and join our community if you found this video useful. Now is the first step on your journey to greater sleep and wellness. We appreciate you joining us on this journey.